Do you deal with eye floaters? If you do, then you know how annoying they can be. Just imagine a bunch of dark, squiggly lines, specks, cobwebs, or whatever shape they may be, just throughout your entire visual field. I developed eye floaters due to having laser eye surgery, and I know of a bunch of other people who developed them as well after having laser eye surgery. However, you obviously don't need to have laser eye surgery to develop eye floaters. There's a variety of reasons why someone may develop eye floaters, which include age-related changes in the eye, post-vitreous detachment, eye inflammation, certain eye injuries, retinal tears or detachments, bleeding in the eye, and just various other eye conditions can cause all these things. Visual snow syndrome can actually cause eye floaters as well. So why do people see eye floaters? The main reason for this is the collagen fibers within the vitreous fluid clumping together, which will cast a shadow in the back of the retina, and this shadow is what leads to the perception of eye floaters. Eye floaters tend to be much more noticeable in brighter environments and against what I refer to as like a monotone background, meaning something that's just basically one color without a lot of varied scenery, such as the sky or the snow against a hill or a mountain. I tend to notice them quite a bit against a bright computer screen, especially when I'm trying to type up a document and the screen is really bright and it's usually a white background, and I'll see them all over the computer screen, and it's super annoying to try to get anything done. So why do people develop eye floaters from laser eye surgery? The following information is taken from the LASIK complications website run by Paula Koffer, and the website states that the surgery causes several types of ocular stress. First off, an increase in intraocular pressure during suction. Secondly, an acoustic shock wave during laser ablation. And thirdly, a rapid lowering of intraocular pressure when the suction ring is decompressed. These mechanical stressors have the potential to damage the vitreous, retina, and macula. Many patients report increased floaters, also known as posterior vitreous detachment, after LASIK. So I just want to specify that you can develop them from all types of refractive eye surgery and not just LASIK. Most people, when they hear about laser eye surgery, they automatically assume LASIK, but there are many other types of refractive eye surgery besides LASIK. I had PRK, which is not LASIK, but a lot of the surgical procedure is pretty identical to what you'd have with LASIK. Developing eye floaters after laser eye surgery does seem to be one of the more common complications from the procedure. I have a multitude of other vision issues besides eye floaters. Eye floaters were approximately the third to last vision issue that I developed. The second to last one was the visual snow, or just seeing static everywhere. And the last vision issue I developed was the palinopsia, or just seeing trailing images, basically anything that moves. And these two symptoms I find to be way more bothersome than eye floaters. A lot of people, eye floaters is their only vision issue, and if that's your only vision issue, you should consider yourself super lucky. I have about a dozen other eye issues besides having eye floaters, and I would be super happy if eye floaters were my only vision issue. But I get it that it's hard to put things in perspective, and if the eye floaters are the only thing that you're actually experiencing, then it can kind of seem like it's the worst thing in the world. But if you end up developing a bunch of other vision issues on top of the eye floaters, then having just eye floaters doesn't seem very bad at all. So, is there any way to get rid of eye floaters? One method is getting excuse me if I don't pronounce this right, vitrectomy. So vitrectomy is an eye surgery that removes the vitreous fluid from the eyeball, and it can be done to remove cloudy fluid or fluid with debris, or to do repairs on the retina or macula. and the vitreous fluid is replaced with a clear fluid or a gas bubble until your body begins producing the vitreous again. So this type of surgery can be used to get rid of eye floaters. Personally, I would never have it done. I think it's an unnecessary medical procedure, and I'm totally against any unnecessary medical procedures for the eyes, obviously because of my experience with refractive eye surgery. And this sounds almost as bad as getting your eyes sliced open by a laser, so it is an absolute no-go for me. There are just too many risks and complications involved with a surgery like this, so it's not something I would ever get. There is another newer surgery that's also used to get rid of eye floaters, and it's called laser Vitreolysis. It's also referred to as laser floater removal. And basically this involves using a nanopulse ophthalmic YAG laser to vaporize vitreous strands and opacities. Again, this is not something I would ever recommend anybody have done. I just don't believe that the risks are worth it with any of these types of procedures. So let me know in the comments if you have any eye floaters, how you developed them, how you're dealing with them, and if you've actually found anything that seems to help decrease them or make them less noticeable. I'd be very interested in hearing about this. Until next time, stay strong, warriors.